5 investigates with a closer look at testing for COVID-19 here in Massachusetts. Our Mike Beaudet found that the state's capacity to test is rising, but the actual number of people getting tested is falling.
There are two kinds of tests: a viral test, which reveals if you're currently infected with COVID-19, and an antibody test, which indicates if you've ever had the virus. Our review of the data shows the number of people getting both kinds of tests is on the decline in Massachusetts. It's something we keep hearing from Governor Baker, most recently on Tuesday.
As of yesterday, we've done over 650,000 tests, which makes us a top 5 per capita test player here in the United States.
And it's hardly the first time the governor has touted the state's record on COVID-19 testing.
Yesterday, we reported 6,300 new tests. That brings the total number of tests conducted in the Commonwealth to almost 340,000, which makes us a top 5 player on a per capita basis.
But here's the reality. Fewer people are getting tested for COVID-19 in Massachusetts. In the last week, the numbers dipped to less than 5,000 viral tests statewide on 3 different days. Antibody testing, which shows if someone's ever had COVID-19, is also on the decline, down to less than 1,000 tests a day. Despite those numbers, Governor Baker is standing by his ambitious goal of increasing viral testing capacity to 45,000 tests a day by July 31st and 75,000 tests a day by the end of December.
I think one of the things we can continue focusing on now in the state is to keep increasing access to testing for anyone who feels that they need it. I think that it's still a difficult test to receive if you don't have the right sort of know-how of where exactly to go to get.
Dr. Michael Mina is an epidemiologist at Harvard T.H. Chan School of Public Health who believes testing, including antibody testing, is key to controlling the spread of the virus.
We came into the virus in crisis mode. The whole effort so far has just been to put out the fires, not to prevent the fires. And antibody testing helps you prevent and slow the fires and mitigate them.
The governor is defending the falling testing numbers.
Testing generally is driven by demand. When we have 30% of our tests coming back positive once upon a time, 30, 40 days ago, and now we have, on some days, under 5% of our tests coming back positive, that changes the nature with respect to who's looking for tests.
The Baker administration says the state is not prioritizing antibody testing because of current unknowns with antibody testing around test accuracy and the relationship between antibody presence and immunity.
I do believe at some point we're going to get to the point where we're going to have a couple of antibody tests that are going to be deemed most appropriate, most effective, most accurate.
Governor Baker is sticking by his pledge to dramatically increase the state's capacity to conduct viral testing in the months ahead, saying the plan is to allow even more people to be tested. Mike Beaudet, 5 Investigates.